for healthcare clients by recruiting qualified professionals. They specialize in placing a range of workers, including registered nurses, doctors, healthcare assistants, and other allied healthcare professionals. They recruit both within the UK and internationally. The company has a dedicated immigration team to assist their clients and recruited candidates with personal and business immigration matters, making the process of moving to the UK for work smoother. MentorWise Magnate Ltd offers a comprehensive range of courses with a strong emphasis on preparing international nurses for UK registration. These include IELTS, International English Language Test, and OET, Occupational English Test. These courses are designed to help candidates achieve the required English language proficiency for UK healthcare registration. CBT, Computer-Based Test. This training prepares individuals for the multiple-choice computer-based exam, which is the first part of the Nursing and Midwifery Council (NMC) test of competence. OSCE, Objective Structured Clinical Examination. They offer a combined online and face-to-face program for the final, practical exam required for NMC registration. They provide training for different nursing specialties, including adult and mental health nursing. MentorWise Magnate Ltd provides a diverse range of educational courses. They offer accredited training in essential areas like health and social care and health and safety. The company also partners with educational providers to deliver diplomas in business and IT, helping students gain qualifications in these fields. MentorWise Magnate Ltd was founded by Moises and Wendell Marcelino, who have extensive combined experience in both the healthcare and recruitment sectors. Having personally gone through the relocation process in the UK, they have a deep understanding of the challenges and importance of immigration support. Their mission is to assist overseas healthcare professionals, including nurses, midwives, and other allied workers, with the complexities of registering and relocating to the UK. By providing comprehensive, or holistic, support to these candidates, they also help to address the staffing needs of UK healthcare providers. MentorWise Magnate Ltd is a UK-based company primarily focused on supporting individuals in the healthcare sector, particularly those looking to work in the UK. Their services and courses are centered around three main pillars: training, recruitment, and immigration. They offer a variety of training programs to help individuals gain the necessary certifications and skills for healthcare roles. This includes both online and face-to-face instruction.
Okay, so hello everyone. Good day. Welcome to our webinar for today. We're going to talk about understanding hypertension. So today we have our guest speaker, Dr. Saksham Kandel. So he will be our guest speaker today, speaking about hypertension. So, Doctor, the floor is yours.
Okay, good afternoon, everybody. I'm Saksham Kadel, and thank you for the introduction. I'll be talking about hypertension for today. So let's go to the slides. Let me. Yeah, is my screen visible to everybody? I think so.
Yes, Doc.
Uh, okay, so let's start. So first of all, let's talk what is hypertension. Hypertension, it is persistently raised arterial blood pressure. So I'll be talking about what arterial blood pressure is in the next slides. But we have to, before that, we have to understand that hypertension, it is a chronic condition, meaning that it cannot be treated but can be managed, right? So before talking about hypertension itself, let's talk about arterial blood pressure. Arterial blood pressure, it is the pressure exerted by the circulating blood on the walls of the arteries when the heart pumps blood throughout the body. So when the blood is moving through the arteries in our body, it exerts certain pressure on the walls of those arteries, and this is what arterial blood pressure is. Obviously, there are two two arterial blood pressure. One is systolic and another is diastolic blood pressure. Systolic blood pressure is the pressure exerted by the circulating blood when the heart is contracting, and the diastolic blood pressure is the blood pressure when exerted by the circulating blood on the walls of the artery when heart is relaxing. So we have systolic and diastolic arterial blood pressure. Now, what determines the arterial blood pressure is the cardiac output and total peripheral resistance. Okay, so what is cardiac output? Cardiac output is the total volume of blood that is pumped by the heart in 1 minute, and it depends upon stroke volume and heart rate. So stroke volume is the amount of the blood that is pumped by the heart in per heartbeat, and if we multiply it by the heart rate, then we get the total amount of the blood that is pumped by the heart in 1 minute, and that is what cardiac output is. And total peripheral resistance, it is the resistance offered by those arteries to the circulating blood. So these are the two things that determine the arterial blood pressure. And I when I'll be talking about the risk factors of the hypertension, I'll be referring back to this formula. So if we understand what determines the arterial blood pressure, it is easier for us to understand what are the risk factor of the hypertension. Okay. Moving on to the types of hypertension, there are primarily two types of hypertension. One is primary hypertension when we do not know the cause of the increased blood pressure, and it amounts for 90 to 95% of the cases. And secondary hypertension is obviously when we have identifiable cause, and it accounts for only 5 to 10% of the cases. So in most of the cases, we don't know what is the cause of the hypertension, but we do know about the risk factor of the hypertension. Okay, obviously, and secondary cause of hypertension include kidney disease and endocrine disease and some metabolic disorder. And kidney disease is by far the most common cause of the secondary hypertension. Now let's talk about the risk factors of the hypertension. So these risk factors are for the primary hypertension. Secondary, as I mentioned earlier, secondary hypertension, it has identifiable cause, and these cause have these their own risk factor. So these risk factor are for the primary hypertension. When talking about the risk factor, there are two type of risk factor. One is non-modifiable and one is modifiable. Non-modifiable are those risk factor which we can do nothing much about. But modifiable risk factor, they are related to our lifestyle, and we can modify this risk factor in order to decrease the chance of getting hypertension. So let's talk about non-modifiable risk factor first. The first thing is as I mentioned earlier, arterial blood pressure, it depend upon cardiac output and total peripheral resistance. So as our age increases, as we get older, total peripheral resistance, that is the resistance offered by those blood vessels artery to the circulating blood, it increases, and that increases the arterial blood pressure and increases the chance of hypertension. Okay, and the other thing is family history and genetics. Obviously, if we have family history of hypertension and there are some genetics involved, which increases the risk of getting hypertension. And about the gender, in the younger age, male are more prone to hypertension than female. Then after the 65 years of age, then women are more prone to high blood pressure than male. So yeah, basically after the menopause, the chances of cardiovascular disease increases in female. Okay. And there are people from African and Caribbean origin with who are more prone to hypertension. So now let's talk about the modifiable risk factor of hypertension. Obviously, as I told earlier, these are related to our lifestyles, and these are the things we can change in order to reduce the chance of hypertension. So, first thing is high salt intake. High salt intake, obviously, obviously, it increases the chance of hypertension. With salt, what happen is if we take high amount of the salt, then the kidney reabsorbs more water, then which leads to the increased in cardiac output, and is mentioned in the formula for arterial blood pressure is equal to cardiac output into total peripheral resistance. So when the cardiac output is increased, then there is increased blood pressure leading to hypertension. So in that way, high salt intake increases the chance of hypertension. And then obviously with obesity as well, there is when you have when you are obese, the chances of hypertension increases, and smoking as well, physical inactivity as well, and unhealthy diet with high unsaturated fat, they also increases the chance of hypertension. And these are the risk factor. When talking about the management of hypertension, I will talk how to deal with how to deal with this risk factor in order to decrease the chances of hypertension. Okay. Now let's talk about some secondary causes of the hypertension. So, as I mentioned earlier, renal disorders are by far the most common cause of secondary hypertension. The reason behind it is because most of our, I think about more than 20% of our cardiac output, it is supplied to the kidney. So when there is inflammation, when there is something wrong within the kidney, that directly affect our heart as well and everything. So, kidney disorder, they are the most common cause of secondary hypertension. So, some of the kidney diseases that causes hypertension are glomerulonephritis, when you have inflammation in the apparatus that filters our blood, and chronic kidney disease as well, and polycystic kidney disease as well, in which you have cyst in the kidney leading to the hypertension. And some of the endocrine disorder like hyperaldosteronism. Obviously, aldosterone, it is a hormone which helps in the reabsorption of sodium. And as I mentioned earlier, when sodium is reabsorbed more, water is reabsorbed more as well, and that leads to hypertension. And pheochromocytoma, when it is a condition when you have tumors that secretes the hormones like adrenaline, noradrenaline, which is associated with which this hormone tends to increase the blood pressure. That is why you have hypertension in pheochromocytoma as well. And then Cushing syndrome, when you have increased amount of glucocorticoids in your body, which also leads to increased blood pressure. And there are some of the drugs they are associated with hypertension, and some of them are combined oral contraceptive pills and corticosteroids as well. So these are the most common cause of secondary hypertension. Obviously, secondary hypertension, it amounts for only 5 to 10% of total cases, but we need to rule out these causes while diagnosing the hypertension. So moving on to the next slide, let's talk about the burden of hypertension worldwide and here in the UK. So worldwide, according to the WHO, it estimates about 1.28 billion adults they have hypertension. When we talk about the UK, according to the survey done in 2017, there were 11.8 million people on England that have hypertension. So that equals to about 26.2% of population, meaning that one in every four individual have hypertension. So the problem is massive. So, as I told you earlier, with increasing age, there are more chances of you getting the you being diagnosed with hypertension. So, in the population over 60 years of age, the prevalence of hypertension is nearly 60%. Okay, so the problem hypertension is massive, and there are few things we can do to manage it. So, in the next slides, I will be discussing about how to diagnose hypertension. So, for diagnosing a hypertension, it can be tricky. There are different guidelines and different recommendations for diagnosing the hypertension. I will try my best to describe it in simple terms. So there are different guidelines in UK, and there are different guidelines in US as well. So you might be confused. Uh, but Obviously, I'll be talking about the guidelines in UK here. And if you want to know about the guidelines in US, you can go to the US different US websites. So, to begin with, what I want to tell you is the cutoff value for diagnosing hypertension is 140 by 90 mm of Hg. In different guidelines, that is the common cutoff point, right? So now let's go to how to diagnose hypertension according to the UK guidelines. So obviously, with any other disease, history taking is very important before for diagnosing any condition. So in the history taking, we have to ask about the presence of hyper symptoms of hypertension like headache, fatigue, and any problem with the visions. Obviously, most of the case of the hypertension, they are asymptomatic, so we need to do regular screening to diagnose the condition at an early stage. The symptoms might not be present, but we have to ask the patient whether they have these symptoms or not. And obviously, in the history taking, we also have to ask whether the risk factors are present or not. We have to ask about the family history and lifestyle history to gain an understanding whether our individual have any modifiable or non-modifiable risk factor or not, and that will help in the management of hypertension later. So, and then we have to do the examination and the measurement of the blood pressure in order to diagnose the hypertension. Now, in the next slides, I will be discussing about how to measure the blood pressure and how to diagnose the hypertension accordingly. Okay, so how to measure the blood pressure for the hypertension diagnosis? So there are two settings where we have to measure the blood pressure in order to diagnose the hypertension. One is hospital setting and one is the home setting. So in the what we need to do in the hospital setting is we have to take the history. Once the patient comes in the hospital, we have to take the history so that person can be relaxed in those minutes, and then we have to that the person should be seated with the arms supported and out stretched. And the next thing we have to be aware is we have to measure the blood pressure in both arms. And obviously, now we use automated machine for measuring the blood pressure. So sometimes this machine can give the wrong reading if there is any irregularities in the pulse. So it is better to palpate the pulse before measuring the blood pressure in any scenario. Okay, so these are the things we have to consider. The main thing is the person should be relaxed. Relaxed. We cannot measure the blood pressure as soon as the patient enters our room. We have to take the history so that the person is relaxed in that time, and we have to measure the blood pressure in the both arms, and make sure to palpate the pulse before. If you think if you suspect the person have any irregularities in the pulse. So, and again, one thing we have to consider is if the patient have the symptoms of postural hypertension, like if the patient gives history of recurrent fall, any dizziness, then we have to measure the blood pressure either in supine or seated position. Okay. Uh, so once we measure the blood pressure, as I told you, the cutoff value for diagnosing hypertension is 140 by 90 mm of Hg. If the blood pressure is lower than that, we don't need to worry about that. But if the blood pressure is more than 140 by 90 mm of Hg, we have to take the second measurement. And if there is significant difference between those two measurements, we have to take the third measurement and consider the lower value between those last two measurements is the clinic blood pressure reading. And that is the value we will use whether to diagnose hypertension or to rule out the hypertension. And if the blood pressure reading is between 140 by 90 mm of Hg to 180 by 120 mm of Hg, then what we need to do is we need to offer ambulatory blood pressure monitoring to confirm the diagnosis, or if the ambulatory blood pressure monitoring is not suitable, we have to offer the home blood pressure monitoring. Now, in the next slide, I'll be discussing about how to do ambulatory blood pressure monitoring and home blood pressure monitoring. So when we are using ambulatory blood pressure monitoring, what we need to do is we need to take two blood pressure measurement in every hour in the person normal waking hour. For an example, if the person normal waking hour is from 7 a.m. in the morning to 10 p.m. in the evening, we have to take two measurement in every hours. And then we have to use the average value of 14 measurement of those. We have to take the average value of those 14 measurement from those values to confirm or rule out the diagnosis. Okay. So when home blood pressure monitoring is used, we have to okay. So when home blood pressure monitoring is used, we have to take two consecutive measurement in one sitting, with those measurement being at least 1 minute apart, and the person should be in sitting position. And we have to measure the blood pressure twice daily, ideally in the morning and the evening. And we have to measure the blood pressure consecutively for at least 4 days. Ideally, we have to measure it for the 7 days, but we have to do at least for 4 days. And then we have to discard the value of the first day and take the average of remaining measurement and take the average of remaining measurement and use that value in order to confirm or diagnose in order to confirm or discard the diagnosis of hypertension. Uh, when using the ambulated blood pressure and home blood pressure monitoring, we have to measure the blood pressure in different time, and use the average value of those measurement, and use this value in order to confirm or discard the diagnosis of hypertension. Okay. So when is the hypertension diagnosed? So obviously, from the previous slide, we know that we use two measurement. One is the clinic blood pressure measurement, and one is the average value of the measurement given by ambulatory blood pressure monitoring or home blood pressure monitoring. So we have to use both values in order to diagnose the hypertension. So the hypertension is diagnosed when the person when the person clinic blood pressure is more than 140 by 90 mm of Hg or higher, or average taken from ambulated blood pressure monitoring and home blood pressure monitoring is 135 by 85 mm of Hg or higher. So these two conditions has to be met in order to diagnose a person with hypertension. So and If and there is one condition called white coat hypertension. So obviously, every person who is in the hospital can who when some individual when they see the hospitals and healthcare professionals, they can be anxious, and the blood pressure can be raised only in this scenario for some individuals. So white coat hypertension is simply okay. White coat hypertension is simply the increase in blood pressure when individual is in the healthcare scenario. Okay, so if there is difference of more than 20 by 10 mm of Hg between the clinic blood pressure measurement and average of measurement in ambulated blood pressure monitoring or home blood pressure monitoring, we have to suspect that person may have the white coat hypertension. So obviously, we don't need to do too much about the white coat hypertension. The individual need to avoid the healthcare setting as much as possible. Okay, but if the clinic blood pressure measurement is more than 180 by 120 mm of Hg, we have to check for sign of retinal hemorrhage and papilloedema, and we have to check for any life-threatening symptoms like new onset confusion, chest pain, and sign of heart failure. If the clinic blood pressure is more than 180 by 120 mm of Hg, and if the individual have these signs and symptoms, we have to refer to the specialist for same day assessment. Okay, and yes, and if there are no signs, if the person blood pressure is more than 180 by 120 mm of Hg, but they have no sign and symptoms indicating for same day specialist assessment, we have to carry out certain investigation to know whether there is evidence of in-organ damage or not. In the further slide, I'll be discussing about what are the investigation that is done to gain the evidence of in-organ damage. But if the person blood pressure is more than 180 by 120 mm of Hg, but there are no sign and symptoms for 7 day specialist assessment, we have to carry out those investigation. And if there is evidence of in-organ damage, then we have to start the patient on antihypertensive medication. Okay. In this scenario, we don't wait for the measurement from ambulatory blood pressure monitoring or home blood pressure monitoring in order to diagnose the hypertension. We directly start patient on antihypertensive medication. But if there is no evidence of inorgan damage, we just have to repeat the blood pressure measurement in 7 days and then see how it goes. Okay. Now, once the hypertension is diagnosed using all of those guidance, then we have to stage the hypertension. Again, the staging of hypertension can be confusing, and there is difference in guidelines between US and UK. Obviously, I'll be talking about the UK guidelines. As we know already that there are two kind of blood pressure measurement we use when diagnosing the hypertension, and same is the case while staging the hypertension as well. We use the value measured in clinic, and we use the value measured in home. So, for the stage 1 hypertension, if the clinic blood pressure measurement is between 140 by 90 mm of Hg to 159 by 99 mm of Hg, and then the subsequent average measurement of those ambulated blood pressure monitoring or home blood pressure monitoring is between 135 by 85 mm of Hg to 149 by 94 mm of Hg, then stage 1 hypertension is diagnosed. So there are two kind of measurement and two different values for clinic blood pressure measurement and home blood pressure measurement, and we have to use both of them while diagnosing the hypertension and as well as while staging the hypertension. So, why is staging important is because there is different treatment, different management for different stages. That is why we need to stage the hypertension. Okay. So, stage 2 hypertension is when we clinic blood pressure is more than 160 by 100 mm of Hg or higher than that, but it is less than 180 by 120 mm of Hg. And when we measure, when we take the average measurement of ambulatory blood pressure monitoring and home blood pressure monitoring, if it is 150 by 95 mm of Hg or higher, then that is stage 2 hypertension. And stage 3 hypertension is when the clinic, for diagnosing stage 3 hypertension, we only use a clinic blood pressure measurement. If the systolic blood pressure is more than 180 mm of Hg and diastolic 180 mm of Hg or higher, and diastolic blood pressure measurement is more than 120 mm of Hg or higher, then we diagnose stage 3 hypertension. Okay. Okay, now let's talk about the complication of the hypertension. So, why we need to keep our blood pressure in tight control is because we need to prevent those complications. Obviously, the complication of hypertension, they are life-threatening, and that is why we have to do our best to keep the blood pressure under tight control. So obviously, complication of hypertension are stroke, which can be life-threatening, heart failure, coronary artery disease, chronic kidney disease, vascular dementia, and peripheral artery disease. All of those complications can be life-threatening. So it is very important for us to keep our blood pressure under tight control. So, furthermore, one of the study done shows that if we keep our blood pressure under tight control, there is decreased chance of those complications happening. So, systematic review and meta-analysis found that in a population studied, every 10 mm of Hg reduction in blood pressure resulted in 17% reduction in coronary artery disease, 27% reduction in stroke, 20% reduction in heart failure, and a significant 13% reduction in all-cause mortality. So there we have it shows that there is evidence that if we control our blood pressure, the chances of those complication happening decreases significantly. Okay. Now, moving on to the next slide. So now I'll be discussing about investigations that should be done while making the diagnosis of hypertension. So, before discussing about the investigation, one thing that we should keep in mind is these investigations should be carried out as soon as we suspect the diagnosis of hypertension. Obviously, as I discussed earlier, for the diagnosis of hypertension, we need to follow the certain guideline. Okay, but we don't have to wait for doing those investigation because the complication can be life-threatening, and the most of the cases of hypertension, they are asymptomatic, and patient may already have developed the complication when they visit the healthcare center. So these investigations should not be delayed, and we should not wait for the confirmation of diagnosis to do those investigation. So these investigation obviously are done to find about the complication of hypertension, and in some cases we do those investigation to rule out the secondary cause of hypertension. So, so investigation are done in order to assess the in-organ damage. Obviously, there are three main organ that is affected by hypertension. one being the kidney, and the another being the being eye, and the another being the heart. So we have to assess the function of these three organs to know whether the complications of hypertension is present or not in that individual. So to assess the function of kidney, what we do is we test for hematuria, and we test for electrolyte, and we test for creatinine, and we test for glomerular filtration rate as well. And we do the fundoscopy to check the function of the eye, and we do ECG to check the function of heart, and we do the SbA1c whether the to know whether the person have diabetes or not. Obviously, when I'm talking about the management, you will know that the treatment option for the person with diabetes and hypertension is different than in the person having only hypertension. So SbA1c is done to know whether the person have diabetes or not. And the other investigation we do is to assess the cardiovascular risk, and for that we do the lipid profile. So there is okay. Now let's talk about management of hypertension. But before that, I want to talk about the Q risks. Uh, Q risks. There is a Q risks that we calculate to assess whether the person is at risk of developing significant cardiovascular event in next 10 year or not. There are different parameter used while calculating the Q risks. Okay, and one of the parameter that is used is the lipid profile. So these QRICs help us to predict whether the person is likely to have significant cardiovascular event like stroke, heart attack in the next 10 years. And if the QRICs is more than 10%, then the person is said to be have the significant risks. So I'll be so we need to calculate this in case of while managing hypertension as well, because the treatment option is different for the person having uh, QRICS value more than 10% and less than 10%. So I'll be discussing that when I discuss about drug when I discuss about the drug that are used in the management of hypertension. Okay. All right. So, management of hypertension, it obviously start with modifying those modifiable risk factor that I have talked about, including diet, smoking, alcohol, exercise, weight loss. Like this thing is included in lifestyle modification. So first thing is obviously diet. There is a dietary approach which is called DAS diet, which we follow in order to manage the hypertension. So the DAS diet, it includes the diet that are rich in vegetables, fruits, low fat dairy products, whole grain, fish, and the diet that is low in sweets and red meat. Okay, so DAS diet is the diet that we have to follow if we want to control our blood pressure. So this is the diet, obviously, which is high in vegetable, fruits, and low-fat dietary products, whole grains, and fish, and it is low in sweets and red meat. And another thing that can be modified is our dietary sodium. As I mentioned, sodium, it plays a role in the development of hypertension. So, what is the recommended daily intake of sodium? It is 2.5 gram of sodium and 2.3 gram of sodium or 6 gram of sodium chloride in a person with hypertension. Okay, and the recommendation is same in the person without hypertension as well. because the goal is to prevent the hypertension. And exercise obviously help in controlling the blood pressures. So at least 150 minutes of moderate intensity exercise for per week, and 75 minutes of vigorous exercise is recommended in order to control the blood pressure. And weight loss is also very important. So for every 1 kg loss in weight, there is 0.5 to 2 mm of Hg reduction in blood pressure. So obviously caffeine, it increases the blood pressure, so reduction in caffeine intake is important. And the another most important thing is alcohol and smoking cessation. Alcohol and smoking, it obviously helps in increasing the blood pressure. So stopping this will help in reducing the blood pressure. So these are the lifestyle modification that can be done in order to manage the hypertension. And these lifestyle modification are always the first line management of hypertension. Even if the person is taking the drugs for manage controlling the blood pressure, and if the person is not making those lifestyle changes, it will be very hard for to control the blood pressure. So, a individual with hypertension should be very careful about the diet, about the sodium intake, and should do exercise. And if he or she is overweight, should focus on losing weight. And if they are taking alcohol and smokes, they need to obviously control that as well, and should also focus on reducing the caffeine intake as well. Okay. So after talking about the lifestyle modification, we have to go about when to start drugs. So when to start drug? For every stage to hypertension, we will start the person on any drugs. And for the stage 1 hypertension, starting drug may not be always necessary. We will start drugs in those following scenario. So if the person is less than 80 years of age and have persistent stage 1 hypertension, we will start drugs if the person have one of these. If the person have inner organ damage, if the person have renal disease, if the person have diabetes, or if the person have established cardiovascular disease, and if the person Curix that I talked about earlier, if we when you calculate the Curix, and if it is more than 10% in those individuals, we will start that person on drug. Okay. So so if the person have persistent stage 1 hypertension and age is 80, and if the person has any one of these, we will start the person on drugs. And for the individual who are under 60 years of age, and if when we calculate the Curix, it is less than 10%, we will start those individuals on drug. But for the individual who are more than 80 years of age, and the clinic blood pressure is more than 150 by 90 mm of Hg, we will start those individuals on drugs as well. So again, as I mentioned earlier, lifestyle modifications should be done along with the medication intake for the proper blood pressure control. Okay, and the treatment recommendation, it will be different if the person is pregnant and if the person has secondary hypertension as well. Okay. Now, this is the picture taken from the one of the NICE guideline, and it is the summary of what we have discussed so far. Okay, so as I here as I told earlier, We have to, if we suspect hypertension in adult, we have to offer lifestyle advice, and we have to continue to offer those lifestyle advice periodically. And if the person blood pressure, clinic blood pressure, we will measure the blood pressure in clinic, and if the clinic blood pressure is less than 140 by 90 of Hg, we don't need to worry about it at all. We have to check the blood pressure again in 5 years time. But if the blood pressure is between 140 by 90 of Hg to 179 by 119 of Hg, then then we have to offer the ambulatory home blood pressure measuring, from whether be through ambulatory blood pressure measuring or home blood pressure measuring. And then we have to investigate for the target in organ damage, and we have to assess the cardiovascular risks as well. And according to the measurement in clinic, and according to the measurement of blood pressure in clinic and home, then we need to stage diagnose the person, whether the person have hypertension or not, and we need to stage the hypertension accordingly. Okay. And obviously, if the person clinic blood pressure is more than 180 by 120 of Hg, then we have to look for the inorgan damage, and we have to look for those signs of retinal hemorrhage or papilloedema, or any severe symptom like chest pain, confusion. If they have those, we have to refer for the same day specialist assessment. If not, we have to investigate for inorgan damage and start the patient on drugs. Start the patient on drugs. But if they do not have any signs of inorgan damage, then we need to repeat the blood pressure measurement on within 7 days. One thing that we have to consider is, as I mentioned earlier, the likelihood of hypertension increases with age. So, if the hypertension is diagnosed in a person under the age of 40, we have to investigate for secondary cause of hypertension, because it is very unlikely for a person to have primary hypertension under the age of 40. All right. Mhm. Uh, now let's talk about choices of drug in hypertension. There are a few general principles we have to follow while making the choice of hypertension. We have to understand that a single antihypertensive drug may not be sufficient while managing the blood pressure, and the additional drug may have to be added in a sequential manner until the target blood pressure is achieved. Okay. And the second thing we have to consider is, while offering treatment to the individual of African or Caribbean origin, angiotensin second receptor blockers should be offered in the presence of angiotensin converting enzyme inhibitor. Okay, because there is evidence that those people will tolerate angiotensin receptor blocker more than angiotensin converting enzyme inhibitor AC inhibitors. And the other thing we have to consider is, if the patient is pregnant or planning to become pregnant, or if she is breastfeeding, we should not offer a C inhibitor or ARB blocker unless essential. If it is essential to start the patient on AC inhibitor or ARB blocker, we have to discuss the risks and benefit with the patient of using that drug. So these are the principle that we have to use and that we have to follow. Now, this is also one of the picture taken from the NICE guideline, and NICE guideline, and it is a guideline on how to prescribe which drug to use in managing the hypertension. Before that, I want to talk about the BP targets. These are the targets we have to maintain while treating the hypertension. So, in the person with age on less than 80 years of the age, clinic blood pressure should be less than 140 by 90 mm of Hg, and home blood pressure monitoring or ambulatory blood pressure monitoring should be less than 135 by 85 mm of Hg. And in the person with 80 years and over, the clinic blood pressure should be less than 150 by 90 mm of Hg, and home blood pressure monitoring or ambulatory blood pressure monitoring should be less than 140 by 145 by 85 mm of Hg. So so these are the blood pressure target that we are trying to achieve while managing the patient with hypertension. Okay, so as I told you earlier, there is different treatment option for the patient with diabetes and the patient without diabetes. Okay, so for the patient with diabetes, the first line of drug we offer them is AC inhibitors or angiotensin receptor blockers. Okay, and if the person do not have diabetes, then we use the different treatment option. So then what we have to consider is the age of the person and the ethnicity of the person. So if the patient have hypertension and the age is under 55, and the patient and the individual is non-African or non-African or African Caribbean origin, then we will still offer the ACE inhibitors. But if the patient is more than 55 years of age, then we will offer calcium channel blocker as first line of management. And obviously, in a person with African or African Caribbean origin, then we will use calcium channel blockers as a first line of management. So, while giving the first line of management to the patient with hypertension, we have to consider whether the patient is diabetic or not, and whether the patient is under 55 years of age or more than 55 years of age. Then the other thing we have to consider is the person ethnicity, whether the person is Black African or African Caribbean origin, and then we will offer the drug accordingly. And if the blood pressure target is not achieved, the blood pressure target that I mentioned earlier, if not achieved with this first line of treatment, then we will go to the second line of treatment. Then we will add in the second line of treatment, we will add another class of drug, class of drug accordingly. Okay, and if the blood pressure targets are still not achieved after the step 2 as well, then we move to the step 4. And in step 4 we will offer the different class of drug than prescribed before. So in step 3, what we do is we will use one SC inhibitors or an SC inhibitor or ARBs, angiotensin receptor blocker, and calcium channel blocker, and thiazide like diuretics. These are the three class of drug we will use in step 3. So we will start with step 1, offering one drug. If the blood pressure target is achieved by offering only by single drug, that is great, but that is not usually the case. We have to give at least two drug to achieve those blood pressure targets. Then in the second step, we will offer the drug of different class. Then in the third in third step, we will also offer the drugs of different class. So in step 3, we will use three drugs from three different classes. And if the blood pressure targets are not achieved even with the drugs of three different classes, then we call is resistant hypertension. And in that case, what we will do is one of the drug that can be added after that is spironolactone. but we have to measure the blood potassium level to add those add that drug. If the blood potassium level is less than 4.5 millimole per liter, then we can add spironolactone, or if not, we will add alpha blocker or beta blocker. So when if the person have resistant hypertension, we have to seek the advice of senior. Okay, so this is how we uh, offer the treatment option to the patient in a sequential manner. But what we have to remember is the drug alone cannot control the blood pressure. We have to offer the lifestyle advice to the patient in periodically manner. Okay, without the lifestyle modification, we cannot achieve the blood pressure target that I have mentioned before. So now let's go to the next slide. Uh, okay. In the next slide, I will be talking about the patient. Hello, I don't know why this is stuck here. Hello, can you see the slide?
Yes, Doc.
But the slide is stuck in between. I don't know why. Okay, I'll stop the sharing and I'll share again. Okay. Sorry for the inconvenience. I will. Can you see the slide now? Hello.
Yes.
Sorry. Okay. Thank you for confirming. So, as I have mentioned earlier, this hypertension is a chronic condition, and it is the condition that can be managed but cannot be treated. So, what we need to do is we need to follow up the patient for a very long time. So, patient compliance is very important if we want to achieve the blood pressure targets. Okay, so for that, patient education is very important, very important. So first thing we need to educate the patient about is the common side effect of the drug that are commonly used in the management of hypertension. The most common cause for discontinuing the medication is the occurrence of those common side effects. Those common side effects are very common and can be managed very easily. And if the patient is not aware about those side effects, they might discontinue the drug, and which will affect in long term. So we have to educate them about those common side effects. So for the AC inhibitor, the most common side effect is the dry cough. And if the patient have dry cough, we will just switch it to the angiotensin receptor blocker, and that will resolve the symptoms. Okay, and for the calcium channel blocker, we have ankle edema, headache, and flossing as well. And if the patient develop the side effect, we can switch it to another class of drug. Okay, and for the loop diuretics, the main common symptom are frequent urination and dehydration, and obviously these are the side effect we can manage easily as well. And if the patient cannot tolerate, we can switch it to different class of the drug. So being aware about this uh, this side effect will make a patient comfortable about taking those drug, and they will know what they need to do while they develop those side effect. Okay, and the other thing we have to do is we have to educate patient on the importance of lifestyle modification. So as I mentioned multiple time, without lifestyle modification, those blood pressure target cannot be achieved only with the drug. So we have to educate the patient on this as well. And the other thing that we have to educate patient is about the complication of the hypertension. Once the patient knows about the complication of the hypertension, they will be more aware about taking the drug and taking those necessary steps that they need to take in achieving those blood pressure targets. Okay, so if we educate the patient properly, then that will result in patient compliance with the drugs, regular monitoring, and everything, and that will make the life easier for a healthcare professional as well as the patient. So there are multiple ways on how we can educate the patient. We can give leaflets and pamphlets, and leaflets are and pamphlets, they are available for every other disease here in the UK. So we can just give the leaflet and pamphlet to the patient. And the other thing we can do is we can give the guidance to the patient about the resources where they can get the information. All right. So I've taken the reference from the NICE guidelines and the up-to-date app for preparing those slides. And if you want any more information, you can visit those sites to gain more understanding about the hypertension as well. I hope I have added something today. I have tried my best to give information about hypertension as well. But if you have any question, please feel free to ask now. Okay. If you have no questions, thank you very much for your time, and I hope you have learned little about the hypertension today. So what we will be doing now is I will be asking for your feedback for the presentation. I think Windell will send some feedback form. I have sent it to her. She will send a feedback form to all of you, and you need to send it back to her. And your feedback is very important, so it will help me to improve for the next presentation. So thank you very much for your time. I hope to see you again soon. Thank you.
All right. Thank you very much, Dr. Saksham. Um, So if anybody has any questions, we're still going to be there's still a little bit more that's going to happen in our webinar today. So if anybody has some questions, you can click the raise hands button on the Teams, and then we will entertain your questions. For now, let's move on. We have a little bit of advertisement about like some offerings that MentorWise Magnet has current like our promotions that's currently ongoing, our services. So yes, so let's go and move into that now. Mark, are you ready? Hello, Mark.
Hello?
Okay. Yeah. So um, go ahead and let's move on to the advertisements.
Okay. I thank you very much, Dr. Saksham. Next up, we are going to talk a little bit about the services and ongoing promos that MentorWise Magnet is currently offering. OSCE trainings. The objective, the objective structured clinical examinations OSCE is a crucial component of the UK registration process for the Nursing and Midwifery Council (NMC). Part 2 of the test of competence comprises a practical examination during which you will be evaluated your clinical and communication skills. MWM offers three types of training every Tuesday from 20:30 to 22 for 5 days OSCE, 10 days OSCE. Visit our website to see our OSCE passers, MentorWise Magnet, and also 10 future bundles, future trainer, future manager, future assessors, future trainer and manager, future internal quality assurance, future trainer and learning and development, future bundle CQC registered manager interview coaching, future bundle 8, future manager and CQC registered manager interview coaching and training, future bundle 9, future trainer manager and CQC register manager interview coaching and training, and the last is future bundle future trainer plus business foundation. Next up, I will be handing over the presentation to January for the next part of the webinar, wherein we will talk about the qualifications offered by MentorWise Magnet. Take it away, January.
So, thank you, Sir Mark. The next slide will discuss the insight regarding the individuals behind Wise Magnet. Wise Magnet, it was founded by Moises and Wendell Marcelino with over 20 years of combined experience in public and private healthcare and more than decided in recruitment and training. Having relocated across the UK themselves, they understand the vital role of immigration support in successful transitions. Driven by their own journey, they are commitment to helping overseas healthcare professional nurses, midwives, and allied workers navig- navigate the complexities of registration and relocation. Their mission is to provide holistic support and candidates while meeting the staffing needs of UK healthcare provides. Next slide, please. Ah, The NCC Education Level 3 qualification. Level 3 International Commendation Diploma for higher education studies. This qualification is a one-year pre-university bridging program designed to prepare students with the essential skills to provide direct entry into the undergraduate first-year degree and international recognized university. Level 3 business suite awarded certificate, diploma, extended diploma. This qualification suite allows to candidates to demonstrate key transferable study skill, mechanical competency, and apply cultural understanding, particularly in the context of international business, as well as a grounding in the essential concept of business and economics. Level 3 diploma in computing. This qualification provides learner with a comprehensive introduction to computing, introduce the field of computing and equips student and show key transferable study skills, mechanical competency and understanding in essential concept of IT and practical computing skill. And the next slide, we're giving to back in Sir Mark to for the last presentation of webinar.
We also have a website in Sari Sari Shop. Explore our wide variety of items from spices that enhance your home cooked meals to treat and snacks that bring you back home with every bite. Browse our shop for a wide variety of international products and flavors. And thank you for listening for the advertisements.
So I would like also to sincerely thank Dr. Saksham for his insightful presentation on hypertension. And he has reminded us that this condition requires not only medical management but also a commitment to healthier lifestyle and regular checkups. And as we live today, let us carry with us the knowledge that hypertension is preventable and manageable when we take proactive steps. And may we also be encouraged to make better daily choices, support one another in living healthier lives, and spread awareness in our families and communities. And finally, we are pleased to inform you that all attendees will receive a free certificate of participation as our token of appreciation for joining this important webinar. And thank you once again, Dr. Saksham, for sharing your expertise, and to all of you here for your time and participation. And may I ask to open our cameras so that we can take a picture of today's event? Please, Churchill, you can take the photo.
Okay, so everybody who's able to open their cameras, so if it's possible, let's open our cameras just so like we have a picture of those who has attended, so we'll get a little bit of like a selfie for documentation. Okay. Um, okay, I guess that's it. Okay, there we go. We have Susan, uh-huh, Mikani, Karen, uh-huh. Okay, I think that's it. Okay, so let's have a picture. So 3, 2, 1, say cheese. All right. Thank you very much, everyone, for attending our webinar today. So stay tuned on our channels. We have a Facebook, through emails as well. We're going to be sending more invitations to future seminars, um, such as this one, tackling over different topics. So stay tuned, and we'll see you next time. Thank you.